can see with me the severe proclination of upper incisors and deficient midface. And imagine if you apply class 3 elastics, what will happen to the smile? You will have upward rotation of the occlusal plane and anticlockwise rotation of the occlusal plane, so you will reduce the incisors show while smiling. So I need to control that. We have almost complete cross-spine, bilateral class 3, reverse overjet. It was a skeletal class 3, it was cervical one. What to do for the wisdom teeth? Remember 57? Okay, we need to extract them. So we extract the wisdom teeth. And this is the top selection. If you want to change anything, this should be retroclined tone. So we modeled his case, bilateral class 3 elastics, but because he has severe class 3, I put the rubber bands from lower force. We put the brackets on the centrals. The brackets on the centrals, they are at 6 millimeters. And because the overjet is too big, I mean the reverse overjet, I added my deprogrammers on the buccal cusp of lower right 7, lingual cusp of lower left 7 because of the cross-bite. Then later on, we reduced the amount of reverse overjet. So I shifted my deprogrammers to lower two centrals. We continued the bilateral class 3 elastics. Now he is in edge-to-edge bite. When I do panorebo, for example, I do the position for the upper right central, upper left lateral. I will mark the door of the bracket with the original torque. So I can remember that I did the position for these teeth with that torque. Now we bypass the cross-bite. But again, maybe you like the bite, but you need to remember the drawbacks. So we have some sort of extrusion of lower incisors, and we have anticlockwise rotation of the whole occlusal plane. So we need to control now the class 3 mechanics. So we added 2 tabs distal to lower canines. I'm applying something, I call it anterior triangular class 3 elastics. And we are correcting the class 3. Now almost we are in class 1. This is the right buccal view. So he has severe class 3. So I couldn't apply class 3 elastics from the canine. It was from lower force. At first we put the deprogrammers on lower 7. Then later on I can add them on the lower 2 centrals. Imagine this is his bite, huh? This is his bite. By the way, he's overweight and so big. So I thought that this will give him the chance to lose some weight. But no, still he's overweight. And when he sits on Blanmica chairs, you know Blanmica chairs, they are compact, small, no? Even if you put that chair in the extra position, once he sits, the whole chair will do this. So he is so big. Now we are in the edge-to-edge bite, in the boundary position. Later on, I can apply the class 3 elastic from lower canine. Then I needed to control my class 3 mechanics. So if this is a clock, what will be the net result of my forces? I mean, this forward chain, this vertical elastic, and I added deprogrammer on lower circle. So what will happen for the whole dentition? You'll have clockwise rotation or anti-clockwise rotation. What will happen? Clockwise rotation. Is this going to support the midface more or less? More. And for that elastic, what do you call it? Is it class 2 or a class 3? Class 3. What's the shape of that elastic? Triangle. And I have two patterns, anterior triangle and posterior triangle. So I will call this anterior triangle class 3 elastic. So that pattern of elastics, especially that vertical component, will increase the incisal show while smiling. So you need anterior triangle class 3 elastics in your class 3 cases. At the end of this session, I may have time to share with you the patterns of elastics that I'm using. So I'm using the 4 tools in the case to control his class 3 mechanics. The same for the left buccal review, nothing special. And for the lower arch, we added tongue tamers. While you are doing your class 3 mechanics, you are still in the flexible wears. So it's fine to lose some of the torque, especially on lower incisors because they have very thin bone. Then later on, while you are increasing the size of the wear, then you are adding the tabs, you are controlling the lower incisors. We are reclining upper incisors, and we are correcting the inclination of lower incisors. So this is the before the treatment with the crossbite and the reverse overjet, and we are now in the finishing stage. I want to do overcorrection. All of that because I picked neutral torque for upper canines. So the neutral torque of upper canines in the class 3 cases will force you to finish your case in, let's say, overcorrected occlusion. All of that reflected on his cheeks. So we supported the cheekbone. He is not the best patient. He has a lot of bad habits. He's not cooperative with vitamin D, and he has a lot of carbs in his food. But for the incisal shoe, this is his incisal shoe before adding the tabs and the anterior triangle elastics. So I want to rotate his smile clockwise. So if you follow his smiling photograph, you see the rotation? Again. Let's see it again. We are doing rotation of the whole smile. We are increasing the incisal show for the eye. So by this, you have seen all the 4 tools for the unwanted forces of class 3 cases. What about constricted upper arch? Now this is the area of dermal ultima. It has the power to give you the arch development.